I guess good afternoon. Welcome to our October Leaders in Public Health. I'm thrilled to have so many folks here in the room. We never know who's going to be in person versus on Zoom, but as I say over and over, you get much more from this by being here in person than on Zoom, although of course I'm grateful that we do have the remote option for those who need it. So a warm welcome to those who are here today. But most of all, a warm welcome to Dr. Hamburg, who is our October Leaders in Public Health speaker. So she needs, I feel, no introduction, but I will give one just in case you're one of the few folks who has not read her bio already. Dr. Hamburg, the reason why she's here is because she is truly an internationally recognized leader in public health and medicine. Currently, she's co-president of the Inter-Academy Partnership, which is an international consortium of national academies of science, medicine, and engineering. She's had multiple other roles over the course of her career, though. She served as vice chair of the President's Intelligence Advisory Board and on the Foreign Affairs Advisory Board for the Secretary of State, was foreign secretary for the U.S. National Academy of Medicine, and president and chair of the American Association for the Advancement of Science. She's a former commissioner of the U.S. Food and Drug Administration and worked with our own Dr. Main in that role. Founding vice president and senior scientist at the Nuclear Threat Initiative, which we'll talk a little bit about today. Assistant secretary for planning and evaluation at U.S. Department of Health and Human Services, health commissioner of New York City, and I could go on in terms of her many incredible roles and awards over the course of her career. One of the other things that I want to highlight as we do go through the conversation today, though, is that she serves in lots of advisory roles right now, including for the CDC Foundation, the Nature Conservancy, and Commonwealth. And so has a number of kind of interesting spaces that she sits in right now, in addition to her personal leadership experience, now is a leader of leaders in her board service, which we're quite grateful for. So Dr. Hamburg, thank you for being with us today. I'm really honored to have you joining us.
Thank you. I'm pleased to be here. I have to say, I'm not on the CDC Foundation board.
Oh, I apologize. I was making things up based off of my knowledge, but you talk a lot with Judy.
And I'm very, very supportive of their important work.
Thank you. Thank you for the clarification. I will say Dr. Hamburg and I know each other through some kind of mutual panels and discussions, including with Aspen Institute and elsewhere. Including with CDC Foundation, which is probably how I conflated the two. So to start these sessions, those of you that have been here before know that I like kind of hearing folks' story. How did they end up in the roles that they've been in? And for you and I have had conversations about how rising into public health leadership, taking the role at the FDA as a commissioner of health and so on, wasn't always the career that you had anticipated pursuing, but that real world events kind of changed the course of your life. I wondered if you could share a little bit about your journey with our audience.
Sure. Well, I really intended to be a traditional academic physician, teaching, taking care of patients, and doing research. I actually was the child of two academic physicians, both with Yale degrees. My mother, in fact, was the first African-American woman to attend Yale Medical School, so a bit of the history of Yale, and my parents met at doing their residencies in psychiatry here at Yale. But I grew up, really focused on that. I saw my parents work and they seemed to love it, and I was excited by science, and I really wanted to take care of patients. And then in the course of my training, after as a first-year medical student at Harvard, getting the message that the era of infectious diseases was over thanks to the advent of antibiotics and vaccines, watching the HIV/AIDS epidemic emerge. And in those early days, nobody knew what caused it, nobody knew what to call it, and we certainly didn't know how to treat it and had very little to offer. I went on to do my residency training in New York City, where I took care of quite a lot of patients with AIDS. Still had nothing to offer them, but it just was such a humbling experience to see these patients dying terrible deaths, being able medically to offer so little, but also seeing the intersection of the medical issues with much broader social, legal, ethical, and political issues. And it really made me think in new ways, and it really made me want to work at that interface of science, medicine, and health with these broader issues. I talked to a lot of people during this period and decided I really wanted to go down to Washington and learn about health policy and expose myself to some new areas of work. And as a medical student, I have to confess that I never learned anything about public health.
So
I don't
still
think,
true for many.
Yeah, and I knew that the cafeteria at the School of Public Health was better than the one at the medical school, but that was about the extent of it. And I don't think that I even knew about the CDC. I mean, I really was that ignorant. So I went down to Washington. My chair of medicine said, if you're not back in 2 years to finish your subspecialty training, do your subspecialty training, you will have thrown away your entire medical career. And it was a great moment when a decade later he called me up and he said, I'm really interested in health policy, can you help me out? But in fact, I didn't throw away my career. I took quite a turn in my career, but I had the great good fortune to have as one of my first jobs being Tony Fauci's special assistant, and worked with him on HIV/AIDS research, taking care of patients, and importantly, doing policy. And this was really the period of engagement with the AIDS activist community, as well as remarkable advances in understanding the underlying disease caused by HIV and the opportunities to begin to develop meaningful treatment. So it was like, for me, nirvana in many ways, and it launched me on this career in public health that I never, ever imagined.
I love that, and I think many of you in the room know that I also had that kind of, oh my gosh, thinking about the systems and structures writ large, which of course is that difference between what we do in public health and what we do in medicine, thinking on a structural level. I will also say Dr. Fauci has an incredible track record of picking great mentees to bring up through the system.
It was quite an experience. I also, maybe I shouldn't say this at a school of public health, but during this period when I was sort of trying to figure out what career path to pursue, I did talk to a lot of people about, should I get a master's in public health? And I was talking to one individual who was saying, you really, you've been in training for so long, and you've now been working at NIH. You probably, don't need to get a master's in public health, but real world experience, and that sort of rang true for me. And he said, the only job you would never be able to have if you don't get a master's in public health is Commissioner of Health in New York City, because the city charter says you have to have an MPH. And I said, well, who would ever want that job? Who would be crazy enough to take that job? So I comfortably decided not to pursue an MPH. And little did I know.
And little did you know.
And the city charter, for better or for worse, has now changed.
Well, but I think it's a really, you and I have had conversations. It's actually one of my goals here for our Masters in Public Health is that it does provide that real world leadership experience, that folks learn about the science, how you collect data, how you analyze it, but also very much how you use it so that the training becomes something that's quite useful for someone who wants to be a commissioner of health, who wants to lead a business, who wants to have a role in leadership in other ways. And I'd actually be interested in talking about that a little more, because I think when I look at your career, I see you as having exemplified one of our strategic priorities, which is making sure that we have pathways to translate outstanding science into real world impact. And there's often that tension between the quality of the science and the need to make decisions. So I'm curious about how you kind of walked that path, especially without an MPH to inform you, but we'll forget,
Well, I'll just, on that last point, say that one of the important qualities of leadership, I believe, is listening to people, learning, being capable of acknowledging what you know and what you don't know, and knowing where to go to find what you need to know. And I was really, really fortunate when I became health commissioner in New York City to have a cadre of people that worked there that educated me in critical ways, and we worked together as a team, and that was essential, because there are tools that you don't learn if you're not exposed to them in the context of public health. There are strategies. There is a set of really sort of classroom learnings that lay the foundation to be able to be a strong leader and to make good decisions. So I had to learn it in a more informal way, but if I had known what I was going to do, I probably would have gotten an MPH.
But I actually think it's a really important lesson around leadership, which is that you don't need to have all of the skills yourself, but that you're surrounding yourself by folks that have the complementary skill set, and there's the leading from below as well as from above.
But one of the fundamentals of public health and medicine and science more broadly, I think, is the importance of generating evidence and using that evidence in the work that you do, and certainly that's been a hallmark of my career, my approach to my work, which is the importance of both fostering the knowledge needed and gaining new insights and understandings, but not stopping there. That's not enough. And a published paper might help you get tenure, but it isn't, at least for me, the end goal. The end goal is translating that knowledge into action and being able to harness advances in science and technology to make a difference for people in need. And whether I was working at the NIH or at Health and Human Services, or studying the problems of nuclear and biological threats, or importantly as FDA commissioner, that had to be the sort of North Star of the work.
How do you think about kind of the evidence-based, right? There's that kind of difference, that trope that we're frequently hearing about evidence-based policy making versus policy-based evidence making. And I hear some arguments on both sides from people who I respect. I'm curious about how you thought about that as a leader, right? You have some science, it's rarely sufficient, right? Science is an always evolving field. How did you think about incorporating what you knew and didn't as you were making decisions in any of the positions? Choose one.
Well, and it's just such a fundamental question, and you as the dean of the School of Public Health, but also as a ER physician, you understand that sometimes you have to make decisions on partial information, and it is hard. I think that you have to start with what do we know about the situation, and how does that inform our thinking. You also have to identify what don't we know, and how can we move as quickly as possible to fill in those gaps in knowledge to make the best possible decision. I think part of that is the process of, if you have the luxury of time, you're not in the ER with the patient right in front of you, but you're in a conference room, is getting the right people around the table and lots of different perspectives. Because sometimes there's more information out there than you realize, but you haven't had it presented to you, or you've been thinking too narrowly about a problem. But usually you end up in a situation, whether it's an acute decision-making situation or one where you have the luxury of a little more time, having to move forward, weigh risks and benefits, and decide on a path forward. Then an important part of it, if you're in a public health leadership role, I think, is how you, or in any leadership role really, how you communicate your decision. And most decisions aren't, absolutely yes, no, forever and forever. Most things are dynamic. Certainly when you're talking about responding to an evolving outbreak or health crisis, and when you need to talk to policymakers and, importantly, the public, I think you have to be honest about the fact that this is the best course of action based on what we know now. This is why we're proceeding in this way. This is what we're doing to learn more. And so recommendations may change over time. But I think one of the problems that we saw with COVID and it's not, a unique problem with COVID, but is sometimes trying to be reassuring, and so being absolute when in fact there is more uncertainty. And I think at the end of the day, you're better served by acknowledging that.
And I appreciate that, kind of also acknowledging how you're weighing the various factors, right? So is it infection? Is it economic well-being? Is it kind of human, and certainly within the HIV crisis, right? I've had conversations with folks about like the decisions to shut down bathhouses and the fact that those had huge implications for human rights and those decisions, right? So how do you kind of weigh those various parts? And with that one, you talked about, working at NIH. I think that amongst our faculty are Greg Gonsalves, who of course was part of ACT UP and kind of some of that.
Well,
yes.
we met across the table.
Yeah. And so to me, that's also part of, as you're thinking about the decision making, is thinking about those partnerships, as you think about kind of bringing people around the table or across the table, as the case may be, the community partners, as well as maybe some unlikely bedfellows as partners. And I think, to me, looking at your career, it's something that has distinguished it. It has been your ability to create partnerships with folks who you may not have thought of as having the same aligned interests. I'm curious about how you think about that process of partnership.
Well, it is interesting, and whether it's temperamental or whether it was because, in fact, I came into leadership roles, very early in my career and in areas that I hadn't been as formally trained for. I early on recognized the importance of partnership. Also, the fact that most of the problems we're trying to solve aren't fitting neatly into any one domain of work, no discipline of science or medicine or one sector. And so if you don't reach out, sort of across, barriers, artificial and real, you probably won't be able to actually find the best and most enduring solutions to the issues that you're working on. So that was sort of part of my thinking from the very beginning. And I had the trial by fire when I was working on HIV/AIDS policy, where we really sort of found ourselves in a situation where the importance of bringing the outsiders inside really was profound. And we learned a lot from bringing the AIDS activists into the conference room, sitting, explaining what we were doing and how we were doing it and why, but also hearing from them how they thought it could be done differently. And I think there was a mutual education process where they really came to understand the importance of investing in fundamental research to better understand the nature of the virus and how it caused disease. That provided the points of opportunity to then develop better drugs and diagnostics and get the answers that they so desperately needed. But we learned from them that we don't necessarily have to do research in a rigid way that we'd been doing it for a long time. We could move research out more to the community and not do it in the ivory towers of a Yale or a Harvard. We could think about the fact that not everybody qualifies for a clinical trial, and if there's a limited number of drugs, can you get access for people in a more compassionate way outside of the clinical trial without undermining the importance of getting those answers from the clinical research, how to redesign clinical trials so you could get answers more quickly. And a lot of things have endured. And when I was FDA commissioner, we were actually using strategies that had been developed during that period in our routine regulatory work. Accelerated approval of drugs came from that period, and compassionate use and other things. So, that learning early on was very, very important. Another profound, I don't want to give too long an answer, but
I don't mind at all. I love listening.
Another profound early learning is on my mind because I had some meetings with Yale faculty earlier this morning, and with one in the audience there, we were talking about TB. And when I was health commissioner in New York City, I was surprised to suddenly find myself forced to deal with the resurgence of tuberculosis and drug-resistant tuberculosis. And I had really learned about TB as a disease more of historical interest than anything else. And what was so striking was that, number one, we had a bigger problem than we had ever realized, but we didn't know it because we hadn't been looking. We didn't have the data for action. But then the challenge was that so many of the factors that were influencing the spread of TB and our ability to appropriately treat and manage TB were outside of the realm and responsibilities of the health department and even the scope of the health and hospital system. And so this, to me, was really an example where the only way to be effective, we had to work across governmental entities and also other sectors, the private and voluntary hospitals, other social services, et cetera. And what was really so rewarding and in this era, perhaps surprisingly rare, was that the mayor really turned to me as his health official and medical advisor, and he took my advice and he supported me fully. And he did something that was really kind of extraordinary, which was, as I explained to him the nature of the problem and that a lot of the issues were in the criminal justice system, in the jails and the prisons, a lot in shelters where there was ongoing spread. He said, you develop a strategy and I will support you. Moreover, I'm going to give you authority over the budgets in TB in the different areas of the city's work. So that we could actually achieve our goals, because if the criminal justice system decided TB was a very low priority, which is something they possibly could have, then we wouldn't be able to do all the things we need to do. So we had an integrated budget. We had a strategic plan that was developed based on sound public health principles and medical knowledge. But it cut across these different areas of activity. We had a citywide meeting that included all the governmental entities and other critical partners outside of government. The mayor came and kicked it off. He gave me a nameplate that said, Dr. Margaret Hamburg, MD Tsarina. and he anointed me the TB Tsarina.
I love that.
And we actually made more progress more quickly than we ever imagined possible as a result.
Which to me, and particularly for students in the room, it's a core lesson, right? Budget is ultimately power, and so him giving you control over that budget. But how about the private sector? I mean, both in that kind of, as I'm thinking about your work on TB, but also even more so at FDA, you had a lot of intersection with the private sector, which I think we often don't think about in public health, right? We think of public health as being it's a public or governmental function, and yet you worked quite closely and saw the power of the private sector. Yeah.
Well, I think it's really, really important, and I think that the success of our whole sort of biomedical research, product development, and innovation ecosystem has been that it is a partnership. Going back to that earlier theme, government has a critical role to play, both in investing, the largest amount of dollars in basic and clinical and applied research, also in setting critical policies and oversight mechanisms. But academia is an essential partner in that ecosystem, but also industry. And it's complicated, and there are appropriate roles, and we have to have clarity when there's conflict of interest, et cetera. But the partnership is essential in moving us forward and really allowing us to be able to harness the fruits of science for the benefit of humanity. And working with industry was complicated. I mean, I wasn't as familiar with that sector, number one, so I had to sort of learn about how that whole world worked, and really defining how to work together as partners, but not at all be influenced by the power of industry to lobby and all of that. Was a tightrope sometimes to be walked. I did not feel, at FDA, and you've had a lot of experience there too, Susan, that there was an influence of industry in terms of decision making and processes, et cetera, that was pernicious. I felt we were mindful to it and set up guardrails. But I think that the benefits were palpable and have to be acknowledged as well, to understand, especially for me, understanding what it felt like to be on the other side of the FDA regulatory process and how opaque it could be, et cetera, was important. But to, again, listen and learn about how things felt, what their understandings of our work was, and how we could adjust to provide more transparency and predictability to our work, I think helped to improve the working relationships and the ability to move forward. And there's absolutely were areas where having, again, all the right voices at the table was essential as we tried to figure out how to regulate emerging new areas of science, for example, where our history and regulatory framework didn't necessarily reflect what was happening in the real world. And we needed to talk about different kinds of strategies in a sort of safe space that didn't have to do with the regulation or oversight of any given product. But that I found also enormously valuable.
It's interesting to me as I'm in conversations with industry now that there are things where they'll say to me, well, I'm happy to have this conversation with you because you're not regulating us, right? And so I can imagine you have to create a very safe space to have those conversations with them. And and I know we've had conversations before about AI and the regulatory framework for that, right? I can imagine that were you FDA commissioner now, that would be kind of a top of mind topic for you about how you think about regulation and something that's evolving. So one of the things that I think is really neat about your career is that eye that you have to the future. And you and I have spent a lot of time in the last year or so thinking about the biggest threats to human health. And we've had a lot of discussions about threats from changes in the federal regulatory structure and some of I know you sit on the Vaccine Integrity Project kind of advisory group amongst others, but also around some of the threats around biological agents being used to do harm. And it's something that I know a number of our faculty are working on. I wonder if you'd mind kind of sharing some of your perspectives on what those threats are to human health, and based off of your career of experience, where you think we should be both diving in with the science, but also thinking about governance. Yeah, that's a big question.
It is a big question. There are many different ways to approach it. I guess what I would say is that number one, there is no doubt that these are challenging times, and that we face as a country and as a globe, some really serious, existential threats to health, safety, and the future. And certainly pandemic threats are one. Climate change is another. And I have worked deeply, as you mentioned in the introduction, on some issues of weapons of mass destruction, nuclear and biological as well. And all of these are issues where science is a big part of the solution, without a doubt, and where we have to work not only on the issues of what affects our country, but also what's happening around the world. So the governance issues are not just oversight of domestic, but it really requires global collaboration and global solutions. Interesting, there are also areas, I mentioned that science is part of the solution, there are also areas where science can be part of the problem too, and that makes it more complicated. How do you provide responsible stewardship of important areas of science and technology, whether it's AI or synthetic biology or nuclear capabilities, either being applied to nuclear energy or, nuclear weapons as a military, potentially military strategy. But so there's the issues of, what are the nature of these threats and the role that we play, and then the issues of governance, and they're both very complicated. The biological threat one I'll focus in on because it was a surprising, there have been many surprises in my career path, and again, I didn't really learn about biological weapons in medical school. In fact, I didn't even know that nations had biological weapons programs, and one of the good things that President Nixon did actually was to call a halt to our U.S. Bioweapons program, because as he said, we have enough weapons to kill ourselves many times over already. But I was health commissioner the first time the World Trade Center was bombed, and I'd never thought about domestic terrorism in any focused way, number one. I certainly had never thought in my role as the chief medical officer and commissioner that preparedness against domestic terrorism or capability to respond to terrorism was sort of part of my portfolio as well. But my thoughts changed very much after that day, and people forget about it, but it was a profound event at the time, both because it was such a large act of domestic terrorism, and it was also clear that it could happen again, and that was a message that came from those who undertook that act, but it also sort of revealed the vulnerabilities. So I started learning about biological weapons and biological terrorism. I could see the overlap with work we were already doing in very serious ways around naturally occurring biological threats, the emergence of new diseases like HIV at the time, resurgence of old like TB, diseases that were traveling with tourism and travel and trade. And so to me, it was sort of an integrated whole, a continuum of threats, but we had to put that deliberate possibility on the threat list and begin to prepare in significant ways. So we started working on that when I was in the health department in New York City, and continued that work when I went to HHS in the Clinton administration, and really brought HHS much more into the whole realm of biological preparedness against those deliberate threats than it had ever been before. But I think today, and then I will stop because this is much too long of an answer, but today we are more vulnerable to both deliberate and unintentional threats, along with Mother Nature's threats in the biological arena, than we've ever been before. As we come out of COVID, hopefully we will not forget what that experience was and our incredible vulnerability to naturally occurring biological threats. But intertwined with that, I think there's a new sense for those who want to do harm of the vulnerabilities to biological agents as threat agents, and the disruptiveness not just to health but to the economy and national stability and international security. We also are appropriately trying to advance our work to be better prepared next time in terms of research, and I hope that our administration will continue to support the importance of those efforts and having medical countermeasures and other tools to respond. But as we do more research to better understand how to develop countermeasures, you're working with dangerous pathogens, and we have to be very mindful about the importance of biosafety in our labs and biosecurity and responsible stewardship, as I said, of that work. And then, of course, we have very powerful new tools of biology in synthetic biology, gene editing, AI. And as you think about how those things all can come together to actually produce tools that could be misused to do harm, it's pretty frightening. So the threat environment, I think, is kind of flashing red. And one thing that worries me is that we, as a nation and as a global community, aren't doing enough to address these concerns to better prepare. And I think the combination of the politicization of many aspects of COVID and the fatigue from what COVID brought down on all of us, people don't want to address these threats right now.
And one of our faculty is currently on leave working with RAND, thinking about kind of the way in which AI is heightening that threat of kind of creation of biological agents. So, but would agree that it's something deeply worrisome. I'm going to do just a final question before I turn it over to the audience, because I'm sure you all, as you're listening, are coming up with lots of things. I will move us from that bleak assessment, which I think is part of public health, right? We identify health threats, we measure them, we think about risk and protective factors, into a slightly more positive, which is kind of the role that we then play in creating the better world that we believe in. So we have to look clear-eyed at where the threat is. And then the question is, so then what do we do? So knowing that the folks in the room are not in control of the federal or global policy structure at this point, although I fully anticipate that some of our students will be 5 to 10 to 15 years from now, what can we do to help create that better world, to help protect against, say, biological threats?
Well, first of all, we have to hold on to hope and belief that we can make a difference. And hope isn't just blind optimism.
Correct.
And it certainly isn't a strategy. It is something that, though, is necessary to keep us moving forward, and some days putting one foot in front of the other. But it is, as President Obama once said, hope is something that you have to struggle for, and you have to fight for sometimes. And I think we're in a period where we have to really hold on to not just our hope, but our goals and our sense of mission about our work. And these are tumultuous times, and some of what we thought were givens in our world are sort of being pulled out from under us, and in some cases demolished. But we have to hold our heads up. We have to remember that public health really matters, and it has made a huge difference. We can't forget our legacy, that so much of the improvements in health and well-being and longevity have come from public health interventions, from improved sanitation and hygiene to vaccines and other public health interventions, and that there's a very bright future ahead, because the science has never been more promising. The opportunities to make a difference have never been bigger. And it is the next generation that's really going to help us rethink public health in the modern era. And we have to think in new ways. I mean, I think if I was going to sort of criticize public health up until recently, one would be that, we were doing things in ways that mattered, but siloed. And this is the moment when we can really think about how to reinvigorate and advance, the practice of public health. And I think a lot of it will be that we need to bring in these new tools for public health and modernize, but we also, the partners are really critically important. And public health has always, one of the things that has always appealed to me is that it's broader in its focus, and it isn't as blinded as some disciplines, always recognizing the social influences on health and the sort of link of science, medicine, and public health, thinking beyond just one geography to thinking globally as well. But we need to reinforce that, and we need to think and act in new ways. And it is this generation that I think is going to really power us through, and it's exciting. It's really exciting. But it's I don't want to diminish that these are hard times and uncertain times, and that's why holding on to the hope and the sense of mission is so key.
I appreciate that, and those who are part of our school know that I frequently talk about kind of that North Star, the idea of us going on a bear hunt together, that we have a plan, you work the plan, right, regardless of what else is out there. And the purpose of this school in particular is to do that reinvention in the same way that you did during the HIV/AIDS epidemic, changing the way that you thought about the public health system. We together are able to change the way that we design and think about science, education, and practice for the future. And I'm looking forward to doing it with all of the folks in the room, but also with brilliant leaders like you. I do want to open things up for questions. There's been a lot of different topics. We have people in the room, we have people online. I'm going to start with a question or two from the room, and then can go to Zoom as well. So people on Zoom, feel free to type things in. Yes. And if you don't mind introducing yourself to Dr. Hamburg, that would be great as well.
Hi, Dr. Hamburg. My name is Tim. I'm at the School of Public Health. I'm in the Advanced Professional MPH program. I have a background in nanoscale bioelectronics for my PhD work. And I am profoundly interested in many facets of public health, hence my presence here. My first question would be to get your reaction to the idea of public scientific literacy, because I feel like that element was one, if we look at the postmortem of the COVID pandemic, one of the elements that was missing in addition to the communication troubles from the CDC and NIH was the general idea of scientific literacy and the understanding of how science evolved. And I want you to comment on that. My second question, question would be where you stand in the interaction between the scientific community and political institutions and the legal institutions as well. Because one of the things that is unraveling, like the demolition of the Chevron doctrine, the weakening of the FDA, EPA, is that the courts have significant authority over how public health policy is being dictated, right? And to me, it seems like scientists are often hesitant to engage the political process because it's a subjective, it's a subjective phenomenon.
Yeah.
Unlike science that is objective in nature, right? So how do we, how do scientists get comfortable engaging politics and ethical and legal ramification of public health? Because in a democracy, politics is still the instrument by which we enact.
Well, two good questions.
Wait, do we have 2 more hours to?
Yeah. I mean, the first I could probably answer quickly, which is in terms of science literacy. I mean, this is a huge pressing problem for our nation. We need to improve science, STEM education in the schools. We need to really advance science education for the near term and the longer term. We live in a world that is so science driven, and there's so many critical science-based issues that public understanding is key, and it needs to start early, and it will benefit us all. Policymakers also need to be educated, and that leads into your second question about, I think if you're going to be effective in any aspect of science or public health policy, you have to engage in politics. And I always found it slightly ironic. I understood the message felt good, but say follow the science, because science-based decisions have to be implemented in a real world context, and you have to work within the political context. You have to also work within the realities of the values and the culture and traditions also of where you're doing your work. So you can never just say this is what the data shows and this is what has to be done if you want to have effective outcomes over the longer term. But it can be very, very hard, and frankly, this is a moment when it's about as hard as I ever could have imagined in terms of political divisiveness and the intrusion of ideology and politics into arenas that really should be driven by science and expertise. And we have to keep working to get a better balance, and we have to work hard to make sure that the confidence in science and leaders in science and public health, that may be a signal to stop talking.
Not at all.
Now I've sort of slightly lost my train of thought, but we have to continually work to restore confidence in science and its ability to offer solutions to critical problems, and part of that involves I think improving the understanding of the public and policymakers in science and the scientific process, which is an iterative one, not a these are the facts, these are absolutes, but science is always the pursuit of truth. It isn't absolute truth. But I think we also have to work on our science communication, which is key as well. So we've got to educate the public and policymakers. We have to communicate better, and we have to learn to work and play better across these different communities.
And I'll say, we actually have a new course this spring. I know you're an AP student, so don't have a ton of elective time, but there will be a new course being taught by another commissioner of health from New York City, Ashwin Vasan, all about kind of this question of how do you lead in this kind of dance between science and politics, if you're interested in that. So
that sounds great. I want to take that course.
Please come. Ashwin, I'm sure, will be glad to have you audit. So another question in the room. Dr. Manan. And then I'll go Zoom, and then if we have time, I'll do another one. And yes, I will say some students, we do have classes that start at 1, so forgive people if it's not you, it's them. So.
Hi, Joan Manan from Social and Behavioral Sciences. I'm interested on your perspective as there's going to be more older adults, more and more in our communities, how you think public health will change in the practice of that.
Wow. Well, that's a pretty profound question in that, I think we have this wave of aging population that we're not prepared to deal with on so many levels, in terms of our policies, our programs, our governmental support systems, And on the community and personal level, we're not prepared with the caregiving needs, et cetera. And the diseases of the aging, we're still struggling to find ways to manage, including, of course, neurodegenerative diseases and Alzheimer's, et cetera. Public health per se, its role, I haven't been asked that question before, but it's an important one to think about. And of course, for me, public health is embedded in so many other things. But one is investments in prevention strategies early on, so that we have a healthier and more active aging population, less burdened by disability and chronic disease. And I think we can do better at that, but at some point, if you're going to get older, and that's inevitable, and so these issues might be delayed. But I do think that that's one critical thing. But I think thinking about how do you promote healthy communities to support aging populations is an important task for public health. I also think that it is an area that really speaks to the need to integrate medical services and social services and community supports in new and better ways. And I think public health could provide real insights and leadership in that domain. So just a few thoughts.
Thank you. Do you want to ask a question from online, Holly?
Yeah, absolutely. Absolutely. We have a question from a student online that said, I appreciated your comment about hope and a sense of mission being important right now. What other advice would you have for someone entering the workforce as a public health professional during such polarized times?
I mean, in some ways, I think being in public health right now, when there's a lot to be discouraged about, public health is actually a great area to be working in, because what you do really does matter. And it's hard to argue. I mean, political divisiveness and as I said, the intrusion of ideologies that may not always align, is very destabilizing. But at the end of the day, health is a shared value, and we have to keep coming back to that. And to be able to be working on programs and practices that support the goal of health for all is pretty hard to argue with. So I think that really take pride and joy in the work that you do, because it is noble. But also, I think, even though we're so embattled in many ways in public health right now, we also can begin to change the narrative.
That's right.
Because health is so critical.
And if any, the students have heard me say this before, if anything, a year or 2 years from now, the work and the expertise that you have is going to be even more important, and to maybe open our eyes a little into the places where this discipline can be used and applied. That's outstanding. I think just knowing that people have classes, I may actually stop there. I think that question of hope and the importance of what we do, but also the importance of leaning into new ways of doing what we do, is a gorgeous kind of endpoint to the conversation, but also an incredible reflection on your own career and all of the ways in which you have brought hope and action to bear. I mean, I really can't imagine having someone sitting here who has had a more varied but also generative career than you. And I feel really grateful, Peggy, to have you joining us today.
Thank you.
Sharing your wisdom and also the ability to celebrate your mother's legacy here. So thank you very, very much. Please join me in giving a huge
Thank you.
And I should say, I know that you yourself are not a Yaley, and we will forgive you, but we can't have you leave without giving you a little bit of Yale School of Public Health swag. So,
well, thank you. Thank you so much. I do have a daughter who went to both Yale undergrad and law school, so she's sort of making up for me.
Welcome. Thank you.
Great.